This is a short presentation on the structure and function of NHS Wales presented by Group 17. Structure and function. The Welsh Assembly Government is a devolved government of Wales and is responsible for setting health policies and funding the health services. The Minister for Health and Social Services is directly responsible and accountable for health in Wales. NHS Wales was reorganised in 2009 after the Welsh Assembly Government's One Wales strategy document, which determined the need for reorganisation to improve health outcomes. It created single local health organisations responsible for planning, designing, developing and delivering all healthcare services within a geographical area. It ended internal markets within the NHS and having one organisation in each area and aimed for a more coordinated approach to healthcare. The NHS delivers primary, secondary and tertiary care through 7 local health boards, which are illustrated on this map. The 7 community health councils are statutory bodies that represent the interests of patients in local areas. They give patients a voice on their opinions of the NHS and the services it provides. There are 7 to fit with the 7 local health boards. There are 3 NHS trusts in Wales. The NHS trusts are the Welsh Ambulance Trust, which is responsible for the emergency services, the Flindray NHS Trust, which is responsible for specialist services in cancer care, and Public Health Wales, which has a purpose to protect and improve health and well-being and reduce health inequalities. The National Delivery Group is responsible for developing and overseeing the NHS. This forms part of the Department for Health and Social Services. The NHS Wales Shared Services Partnership is an independent organisation owned by NHS Wales and carries out a service and support function. Pharmacy services. The services that are provided by NHS Wales are similar to NHS England by providing similar essential, advanced and enhanced services. However, discharge medicine review service is something different that was introduced in Wales. The DMR service aims to provide support to patients recently discharged from hospital by ensuring that changes made to the medications are enacted as intended in the community. The medicine use review service is also done in a different way. Patients don't have to receive services from the pharmacy for a period of 3 months to be eligible for an MUR service. Claims for MURs undertaken are claimed electronically through National Electronic Claims and audit forms. Also, the MUR national target groups are different. The final difference is that the changes to the arrangements in England introduced in July 2009 do not apply in Wales. Patient experience in Wales differs in 3 ways compared to England. One of them is cost. Free prescriptions were introduced in Wales on the 1st of April in 2007. This meant that all patients who have a Welsh GP are entitled to free prescriptions from a Welsh pharmacy. This is different compared to England, where the prescription charge increased to £7.85 on the 1st of April in 2013. There are also no charges to pay for staff or visitors when parking at hospitals in Wales, except in a few hospitals where the car park is managed through external contractors. Again, this is differs in England, where most hospital car parks still charge and the price can range anywhere between £2 and £24 per day. Another difference is the waiting times. In 2011, both England and Wales were set the target of aiming for 95% of all patients that visited the accident emergency department to spend less than 4 hours there. England exceeded their target. They achieved 97.4%, whereas Wales only achieved 88.1%, meaning on average patients waited longer in A&E in Wales than they did in England. The final difference is the duration of hospital stay. The length of stay for a patient varies in both Wales and England. For example, in 2005 and 2006, the mean length of stay days in England was 6.8 compared to 6.9 in Wales. However, by 2008 and 2009, this has changed quite significantly. The mean length of stay days in England had reduced to 4.3, whereas in Wales this figure had only reduced from 6.8 to 6.3. Although there are many different factors that could affect this result, such as patient characteristics and the variation in community and aftercare available to patients, and the results do indicate that there are varying lengths of performance in this area between Wales and England, and there is room for improved efficiency in Wales. The references used for this presentation can be found online and are put on this slide. Thank you for watching our presentation.